My name is Sarah Tencer. I have my master's in social work and my pronouns are she, her, and hers. As a disclosure, I am a presenter being paid by PTC Therapeutics and I am not a medical professional. Some of you may have already transitioned from a pediatric clinic into an adult clinic. Some of you may be in the process of that transition or just planning ahead for it. Regardless of where you are in that process, once you turn 18, your doctor is going to expect to be able to communicate directly with you and not just a caregiver or a parent, someone else in the room. So you need to be able to be prepared. And that's going to include preparing for your visit, communicating and making the most of the visit while you're there, and then also following through on next steps and following up with your doctor. In each of these stages, I've created a short acronym to help with remembering kind of how to conduct yourself during that process. SHORT stands for specific, honest, open-minded, relevant, and time-focused. So we'll talk a little bit about that more in detail in the following slides. First, we'll talk about preparing for your visit. One big important step in preparing for your visit is having notes ready. This doesn't necessarily mean just jotting things down in the waiting room or the night before you go in, but rather keeping a journal and keeping notes of things that happen leading up to your visit, possibly even since the last time you saw that doctor. This way, your notes can be specific, so that's our S, and also time-focused, that T. That means that if you're experiencing a symptom or a side effect, something that you're going to want to talk to your doctor about, you can make as many specific notes as possible. So for instance, if it's a discomfort that you're feeling, where exactly is that discomfort? When does it happen? How severe is it? Is there something going on that triggers you to feel that discomfort? Does it happen, a certain time of day or right after you take your medication? Make notes of that every time it happens. And then with time focused, make sure that you're taking note of when it occurs. So specifically the date that it happens, and then also maybe the time of day and the duration. So that way when you're talking to the doctor, you can very specifically say, this has been going on for 3 months and it's happening 3 to 4 times a week, as opposed to maybe trying to recall in the moment, oh, it's been happening a lot, I don't know exactly when it started. The second thing that you're going to want to talk about is your medication, making sure that you know exactly what you're taking, the dosage, how often you're taking it, and also being honest with the doctor about if you've been good about taking your medication or doing the stretches that they've told you about. H is another part of our acronym, right? Honest. And that way they're getting a clear picture of where you're coming from and not jumping to any conclusions. The final thing I'll say about preparing notes is that you should think about how you're going to want to take notes while you're at the doctor and then prepare your notes in the same way. So for instance, if you like to write things down with a paper and pen, make sure that you're doing that beforehand so that when you're bringing your notes with you, you already have that notebook ready to take notes during the appointment. Similarly, if you prefer to use technology, a touch screen, an iPad, something like that, if you take notes on that iPad, it means that you're less likely to forget it the day of because you're going to know you need to bring it with you. The second thing to do to prepare for your visit is to make a list of questions. This may sound simple, but it can be really easy to forget all of the things that you wanted to talk to the doctor about the second you walk into the door. I know that happens to me all the time, and then I remember it the second I get in the car. If you have a list of questions with you, you're less likely to be put on the spot and you know what you're going to want to talk about while you're there. The last thing to think about in preparing for your visit is considering who you want in the room with you. If you're 18, that means you don't have to bring a parent or an adult with you to the appointment. You can do it by yourself if you want to, but you can bring someone. Having someone else in the room can be really helpful. Think about who you want that to be so that you can communicate that with them. So maybe asking someone to come with you, or perhaps that means asking someone not to come with you if it makes you less comfortable for them to be there. And also make sure that you're communicating with that person what you expect them to do the day of the appointment. That way you don't get to the appointment and they're jumping in, asking questions when really that's not what you wanted them to do during that time. Communicate your expectations clearly, and then on the day of, it should run pretty smoothly. So next we'll talk about communicating during your visit. We've already talked a little bit about the short acronym and preparing, and some of that's going to apply the day of as well. Things like being specific. Everything that you've been specific about in your notes, you need to be specific about when you're communicating with your doctor. The more details they have, the better they're going to be equipped to come to the correct conclusions about what's going on. We also already talked about the H for honesty a little bit. We talked about how that means being honest about whether you've been taking your medication on time or doing the stretches they've talked to you about. But it also means being honest about the pain you've experienced or discomfort that you may be feeling. During a doctor's visit is not the time to be tough. If you've been experiencing a pain that's maybe an 8 out of 10 on the pain scale, there's no need to say that it's only been a 3 to try to downplay the pain that you've been experiencing. Be really honest about what that's looked like, because again, if the doctors have the correct information, they're going to be able to come to the correct conclusion, and that's going to benefit you more in the long run. The O is for open-minded. So there's new research being done about Duchenne all the time. This means that there could be new research to talk about, new therapies to talk about, new clinical trials, things like that. If your doctor brings this up in your visit, receive it with an open mind and try to withhold judgment until you have all of the details. Being open-minded doesn't mean that you have to say yes to everything. It just means that you need to hear it and process it and really think things through. The R is for relevant. So I did say to provide as many details as possible. This does not mean that you can go on tangents and provide a lot of irrelevant details in addition to what you're sharing with the doctor. On the flip side of being specific, if you're providing a lot of irrelevant details, the doctor is then going to have to parse through everything you've said to try to get to the part that's actually important to what you're doing. This is something that I think could be helpful if you have a tendency to do this, if maybe you tend to go on tangents when you're feeling nervous or anxious. It can be a role for the person that you invited to be in the meeting with you. So if you know that you do this, you can maybe delegate that to them. Say, if I start to really get off track and talk about things that aren't important, can you just tap me on the leg and get me back on track, just as a subtle reminder of, oh yeah, I need to get back to my point. That can be a good way to make sure that you're not necessarily having to pay attention to it, but that you are staying on track. And then finally, the T for time focused. We already talked about being able to articulate specifically when you've experienced things and the duration of them. This will also be important in talking to your doctor about future plans. So if they're talking to you about new stretches, new therapies, things to be considering, be thinking about the time frame. When am I supposed to be doing that? How much time is it going to take up? When should I start? Things of that nature, so that you're always having that timeline in front of you. Next, in communicating during your visit is taking notes. So you've already prepared your notes, so you have your notebook or your iPad or whatever it is with you. That way, when the doctor's talking to you, you can be taking notes of what they're saying, and you're not putting pressure on yourself to remember every single thing they say to you after the visit. Because doctors can provide a lot of information, and it can be really hard to soak it all in, process it, and remember it later without having those notes. If you're someone who has trouble writing things down while you're listening in a way that's going to be meaningful, there are 2 options that I can think of. The first is to ask the doctor to take breaks. So if they've given you a lot of information and you didn't want to take notes in that moment, ask your doctor to pause, give you time to catch up with your notes, and then move on to the next thing. Most doctors are not going to mind that because they're going to want you to retain that information. The second option is if you have someone with you, again, that can be something that you can delegate to the person attending the meeting with you. So if you don't want to have to take notes at all, that can be something you ask them to do, and that can be their job while they're in the meeting. That can also be helpful if you have someone who does tend to want to jump in. They're taking notes, so they already have their hands full doing something. Third is double check your questions list. So you've prepared this, you've brought it with you, but the odds are the appointment isn't going to go point by point through your questions list, answering things in order. Probably the doctor's going to voluntarily answer questions out of order, or if you answer a question, maybe their answer includes things that answer 3 of your questions instead of just the one that you originally asked. If that's the case, when you get to the end of the appointment, make sure that you're looking back through so that if you have been jumping around, you don't accidentally forget something that you were meaning to ask that's important. When you are asking questions, make sure that you're repeating the answers for clarity. This doesn't just mean repeating back what the doctor says, because being able to repeat it is one thing, but comprehending it is something completely different. So make sure you're repeating back in your own words. That way, if you have misunderstood or if you've missed an element of what they've told you, that gives them a chance to clarify that. If you need to do this multiple times, That's okay. It's not a reflection on you if you have to ask a doctor to repeat something multiple times or say it in a couple different ways until you get it. Doctors can sometimes talk in a pretty highbrow way or in ways that don't make sense to us if we're not used to hearing those kinds of words. And so it's okay to do that. And finally, preparing for follow-up. So our next slide is going to be completely about follow-up, but there may be things that you need to do in the appointment that then prepare you for that. Things like making sure you know how to schedule your next appointment. Maybe you do it before you even leave that day, or making sure that you know how to ask follow-up questions if you have them, what that timeline is going to look like, as I mentioned earlier, so that you're really equipped to be successful in your follow-up. So finally, following through on next steps. Some of this you may have done at your visit. Like I said, maybe you scheduled your appointment before you left. Some doctors will require you to log on to an online portal after you leave and schedule your appointment that way. So it's important to know how to navigate that and make sure you have access to that online portal. If you don't have access to the internet or aren't able to really navigate that easily at home, make sure you communicate that to your doctor before you go so that you do have a way to communicate with them if things come up. Online portals can be helpful for scheduling appointments, and they can also be helpful sometimes for asking follow-up questions. So once you get home, make sure to review all of the notes that you or the person that came with you took during the appointment. And you may think of questions after you left that you didn't think of in the meantime because you had a lot going on while you were there. Online portals can be a way to submit those questions and get quick feedback from your doctor. I don't say this as a way to replace what should be an actual doctor's visit with an email or a message through the portal. If you have questions about things that didn't get covered during the appointment, you really should either wait for your next appointment or schedule a sooner one to talk to your doctor in person or over video if you're doing it online about that. The portal and follow-up questions are more so meant for if you didn't actually understand what the doctor wanted you to do, or if you've really got a question that impacts your ability to do what the doctor said during your appointment. Those are things to do during follow-up and to make sure that you do quickly so that you can follow through on the advice that the doctor gave you. For more information about communicating with your doctors and making the most of your doctor's visits, I've included 2 resources here that you can maybe take a note of and go look at later for some additional information.